Mr. President, there are reports that the government will be reopened tonight or tomorrow morning. And all I can say is it's about time. It's been 40 days too long. But we also know that there's going to be some vote in the not so distant future on what do we do about high health insurance costs, and then hopefully another vote as to what can we do about the high health care costs that are driving the high health insurance costs. And we need to talk now. We can't just come upon the vote and suddenly have a solution. Rather, people need to be thinking about it between now and then about the solutions that benefit the American people. Clearly, we have a problem with the affordability of health care and of health insurance. And of course, that's related. And this is something that in my professional life as a physician, I addressed over 20-something years before entering political life. I practiced in a public hospital for the uninsured for over 2 decades, seeing middle-income and lower-income Americans, fellow Americans, who for whatever reason couldn't afford their insurance or couldn't afford their health care, and they came to the hospital for the uninsured. Now, health insurance, health care costs, very complicated. And we've got to be a little bit more creative than just the federal government throwing money at it. Obamacare tried to do that, and it has not worked. The enhanced premium tax credits, or the EPTC, is the latest example. It was a COVID program unrelated to the original Obamacare program, and the enhanced premium tax credits sent billions of taxpayer dollars straight to the insurer, hoping that families would see smaller bills. But it might paper money over the high health insurance costs, but it did nothing for health care costs. And by the way, it also made health insurance more expensive for many. So I think we can do better than just hiding the cost of high health care and high health insurance costs by the federal government spending billions more. So an idea that I'm asking my colleagues and the American people to consider is a pre-funded federal flexible spending account. Now let me make a couple things clear. First, I am not speaking for John Thune, the majority leader. I'm not speaking for Donald Trump. In fact, although I'm the chairman of the Health, Education, Labor, and Pension Committee, I'm more speaking as Bill Cassidy, a doctor that worked with the uninsured for 20 years and is now representing the great state of Louisiana. And I'm speaking to my colleagues and to fellow Americans, asking all of us to put aside our prejudice, to put aside our kind of, oh no gosh, a Republican's proposing it or a Democrat's proposing it, so therefore I must oppose. No, to actually come together in good faith to try and find a solution. So let me first describe what I'm speaking of. First, there are 2 types of tax credits on the Affordable Care Act exchanges, the Obamacare exchanges. And I'm going into this for a reason. One is the baseline tax credit that was enacted into law in 2010 that lowers premium costs for those less than 400% of federal poverty. So, first one started in 2010 under Obamacare, the original legislation. It goes to people making less than 400% of federal poverty. During COVID, there was another sum added called the enhanced premium tax credit. And that gives some extra benefits to those less than 400% of federal poverty level, but began to cover people over 400% of federal poverty level. So 2 pots of money. One pot dates from 2010, part of the original Affordable Care Act law, and the other passed by the Biden administration during the COVID pandemic, benefiting those above 400% of federal poverty. What I'm proposing does not touch that baseline. What I'm about to propose does not touch the monies that were set aside in 2010 under the Affordable Care Act. Why do I say that? President Trump endorsed the concept I'll be speaking of, and one of my Democratic colleagues said, wait, are you going to give all the insurance money for these accounts? No, time out, absolutely not. We're going to leave that portion which was part of the baseline alone, not touching it at all, but trying to do something with the enhanced premium tax credits that only began most recently by President Biden under the COVID pandemic. That begs the question, why were enhanced premium tax credits necessary? Premiums had gone up so much. The Affordable Care Act was supposed to lower the cost of health care. The cost of health care has exploded. The cost of health insurance has exploded. And unfortunately, under the enhanced premium tax credit, it doesn't matter what the premium is. The federal taxpayer throws billions more at it. And the insurance company lost the incentive to negotiate down prices because whatever the price was, the taxpayer would help pay for it. And we misaligned the incentives to where the insurance companies actually do better if health care costs are high. Now, by the way, I'm not here to bash insurance company. We need them, they're essential, but everybody's going to respond to incentives, and the incentive here is not the right incentive. So, how can we do something different? Well, I'd like to empower the patient instead of sending billions to the insurance company. And if we can put in programs that lower health care costs, we may still have premiums that are too high this year because, my gosh, we only got 2 months until the next plan year starts. But we're going to be able to substitute out these enhanced premiums with something which doesn't go to the insurance company, but goes to you, the patient. And we're going to begin the process of aligning the incentives for giving the patient the incentive to find the better deal, and that begins to lower cost. By the way, that means that we have to think differently. Now, let's try a new approach as opposed to just sending paper money to paper over the high health care cost and the resultant high premiums. Where's our health care? This is kind of my idea, Mr. President. Right now, we have the enhanced premium tax credit, which I've been speaking of. It goes to the insurance company. That should say 20 right there. It says 80. I'm just going to mark that out right now. I'm just going to, right now, Mr. President, give me just a second. I'm going to take this down. I'm going to go like this, and I'm going to go 20. And but that 20 is the administrative cost and the profit that the insurance companies take out of every dollar you take them. I wish I had two marks a lot. My assistants get me a marks a lot. I need to do that. Oh, right there. No, because I had a misprint last night. I don't want it to be misprinted now. This should be 20. 20 of that 26 billion we're going to send them next year. 20% of the 26 billion goes to profit, and it goes to administrative cost. Can we do it better? By golly, we can. Mr. President, here we go. I'm going to get this out of here. I'm just bugged the heck out of this. This should say 20. 20% of the 26 billion we send them next year would go to profit and administrative overhead. What if we give the patient the power? What if we say it goes to an account that she controls, that she can spend on her physician, her dental care, her prescriptions, on her eyeglasses. She can spend it on orthodontia. She can spend it on more things than this. And by the way, 100% of the 26 billion would go to the real care that that woman and her family needs. So we need to empower her, not give 20% of $26 billion to insurance companies. Nothing against insurance companies. God bless them, we need them. But if I have a choice of empowering you or empowering them, 100% to you or 20% to them, my vote's with you. And I think we as a Congress, no matter what your political party, should all vote the same way. I want to emphasize something here, by the way. This is pre-funded. People think about flexible spending accounts and they think, well, my gosh, this poor person, 120% of federal poverty, 150% of federal poverty, has to put their own money into this. No. We take the dollars that are in the enhanced premium tax credit and we put them there instead, and it's pre-funded. So, a little different than we normally think of flexible spending accounts, but it still works. Now, a couple of things I've heard from my Democratic colleagues, by the way. My Democratic colleagues are concerned that whatever we pass over here will not get a vote in the House of Representatives. I'm pleased to say, yesterday, President Trump tweeted in favor of this proposal. I'm sure he would ask Mike Johnson to take it up. If Democrats want to vote on something that benefits the American people, on here. And by the way, here's the tweet. You can't read this. It's classic President Trump. He's talking about money-sucking insurance companies. And then in all caps, he goes, be sent directly to the people so that they can purchase their own much better health care. That's the president's way of emphasizing, let's give power to the people, not send 20% of the money to the insurance companies. And as I said, with this tweet, the president indicating his support, I think we can rely upon him to ask Speaker Johnson to bring it up in the House of Representatives. So if Democrats want to vote on something that will have a vote in the House, they got it right there, the president's endorsement. I think this works all the way around. And let me say once more, after the president tweeted, I'm going to repeat, but it's important to repeat because this is a point of misunderstanding. After the president tweeted this, one of my Democratic colleagues said, wait, are you going to give all the money to this account for these people? And the answer is no. The baseline continues to go to buy the health insurance policy, but that enhanced premium tax credit is the sum that goes there. And I'm just going to say this once more. It is the enhanced premium tax credit that goes there. Now, the other thing I hear, this is way too complicated. No way, can't do it. Can't do it. Turns out, I have a flexible spending account. Over 70% of government employees in the United States of America have a flexible spending account as one of their offerings. Over 40% of those in the commercially insured market have a flexible spending account as one of their offerings. The state of Indiana has used something similar to this for their Medicaid population, and it's worked extremely well. This is not so complicated that federal employees, Medicaid recipients, you name it, 70% of our fellow Americans have the option of choosing this if they work for a government entity, and over 40% if they work for a business. So this is something which is already out there. And then I'm told, well, the federal government has to set it up. You know, I will point out that I am on an Obamacare policy through the Small Business Exchange. My FSA is already administered by the federal government through the Small Business Obamacare Exchange. All we're asking them to do is to open that window a little bit more and to take in the individual market Obamacare exchange. We already have the existing mechanisms to do this within the federal government. This can be done. We should not consider it so complicated to accomplish. Now, inevitably, there's going to be some bureaucrat that says they need 6 months to open a window. And that's why I'm glad President Donald Trump is the president when this is coming up. Because if there's one guy that can cut through the bureaucratic, I'm a gastroenterologist and certain terms came to mind. And you're a farm state, maybe they do to you. But the one guy that can cut through the stuff that seems an obstacle to others, it's President Donald Trump. I always smile. Operation Warp Speed, they said it might take 18 months, maybe 10 years to get a vaccine to market, and President Trump's leadership led it to being in people's arms from before we started within 11 months. This man can make it happen. So I don't consider it too complicated for the patient to understand, and I don't consider it too complicated for the federal government to adapt to, which means we could even do it in 2026. Now, next thing I hear, is it going to cost money? It's going to cost money. And again, my Democratic colleagues should like this because the first year, it'll cost about the same as the enhanced premium tax credits. Because right now, we're 2 months from the beginning of the year, and there's not a whole lot of time for reforms to be put in place to lower the cost of health care. So for our fellow Americans who are dependent upon this, we can fix it for them. But now, we also have the opportunity to pass other reforms that truly will lower the cost of health care. So come 2027, these reforms, those reforms begin to work down the cost of health care, and we as Americans will benefit not just in the Obamacare exchanges, but in the commercial market, in the Medicare space, in other spaces as well. We begin to lower health care costs for all. That's more value for the individual, more value for the employer, more value for the taxpayer. So the choice is before us. We can continue to try and paper over the cost of health insurance by throwing billions more at it. Under the enhanced premium tax credit, the money goes to insurance companies and 20% gets hung up in administrative cost and profit. Or we can spend 100% of it in pre-funded flexible spending accounts benefiting patients and their families. What can it be used for? Under the enhanced premium tax credit, you're choosing to use it for insurance premiums and whatever the insurance company thinks you should get. Under the pre-funded flexible spending account, you decide. Or, since I'm looking at a Senator Kramer's wife decides, because women make most of these decisions, and she'll decide to pay for dental, physician, glasses, prescriptions, or orthodontia, you name it, she gets to pick. Who makes the decision? Under the enhanced premium tax credit, insurance companies. Under the pre-funded flexible spending account, the patient does, the mother does, the wife does. These are the people that will then make the decisions. And does it lower cost? No. Under the enhanced premium tax credit, it drives premiums up. Under the pre-funded flexible spending account, we empower patients to shop, to find the best deal for their dollar. That drives competition, and that lowers cost. Mr. President, I cannot imagine why anybody would choose the status quo of enhanced premium tax credits versus giving the patient the power. We should give the patient the power. And I say this, and I want to be very clear here. I am not being partisan. I am being in good faith trying to say that everyone should put their party behind them, put their partisan politics behind them, and be focused only on how do we lower health care costs for the average American. No, for all Americans. How do we lower health care costs? That should be our focus. My staff asked if I'm wearing a purple tie because I'm bipartisan. I said, no, I'm wearing a purple tie because LSU lost badly last night and I thought we should encourage them. So this is my LSU Tiger tie. That said, just so it works out that I am really emphasizing this is something that we can work on together. President Trump's for it. And I'd like my Democratic colleagues to consider it. Not just reject it because a Republican proposes, but to actually realize it's in good faith trying to find a solution for the high health care costs that are hurting American families. Let's take a risk. Let's take a risk. Let's be bold. Let's do something different than we've done before. No, the same thing we've done before, but we've done it in a different space. We've done it on the small business Obamacare exchange. We've done it through our employer. We've done it through the Indiana Medicaid program. Let's try it in the individual exchange. Let's just trust that patient to make wise decisions for ourselves as opposed to treating them like something the federal government has to tell them what to do. I'll return where I started. As a doctor who took care of the uninsured for 20 years, I always found that my patients, even if they weren't really educated, but you explained the options to them, they made wise decisions. They made sophisticated decisions. When you gave them control of their health care and you allowed them to make that wise decision. Let's trust the American people, Mr. President. Let's give power to the patient, not billions to the insurance companies. And with that, I yield.